Assalamu alaikum students and welcome back to Professor D Codes. So my targeted topics that I want to deliver you are blood transfusion, ABO blood group system and RH blood group system. But before we start these topics, some basic information and knowledge is important for you to get in order to get better understanding of these topics. So today's video is just an introductory video in which I'll be making foundations for these topics. Today we will be discussing basic blood composition and concepts related to antibody and antigen. So suppose this is your blood vessel and inside this your blood is flowing. Your blood contains different things or components, or you can say it's just like a bowl of soup in which you see a liquid portion and solid portion like vegetables, corn, chicken floating in the liquid portion of your soup. So same is the case with your blood. It has two distinguished portions. Liquid portion which is called plasma, and in plasma there are some suspended or floating blood cells. And in our blood we have three main types of blood cells: erythrocytes, also known as RBCs or red blood cells; leukocytes, also known as WBCs or white blood cells; thrombocytes, also known as platelets. So if I label this diagram, we can identify all previously mentioned components: platelets or thrombocytes. Liquid portion of blood, here represented by yellow color, is plasma. RBCs or erythrocytes and WBCs or leukocytes. Yes, we have different types of WBCs, but for now, this information is sufficiently enough for you. I will be discussing about blood cells in any other video of mine in detail. So now let's get into the concept of antigen and antibody. Suppose this yellow splash is plasma from your blood, containing blood cells. In your plasma, you have structures like this. These structures are known as antibodies. Talking about antibody, so it's protein in nature and is produced by our immune system. Antibody has specific binding site for specific antigen. That's why the site is designated as antigen binding site, where antigen comes and binds with antibody. So one of the blood cells are RBCs, and on the surface of RBCs there are some structures known as antigen. Antigen can be protein in nature, or it can be made up of sugar or lipid or nucleic acid. But the point is, antigens are found on the surface of the cells like our RBCs. Plasma contains antibody, and on the surface of RBCs we have antigen. Specific antigen attaches to specific antibody. Okay, so now suppose we have four patients. Patient number 1 is from blood group A. Patient number 2 is from blood group B. Patient number 3 is from blood group AB. And patient number 4 is from blood group O. Now I am supposing that antigen A is triangular in shape and antigen B is circular. This supposition is only for our convenience and understanding. So RBCs of patient number 1 of blood group A contains triangular antigens, means antigen A. RBCs of patient number 2 of blood group B contains circular antigen, means antigen B. So it means if I am saying that patient's blood group is A, it is just because of antigen A present in that person. Similarly, if patient's blood group is B, it is just because of antigen B present in the RBCs of that person. So now if patient's blood group is AB, then what do you think? What type of antigens are present on patient's RBCs? Yes, you're right. Both A and B antigens are present. That's why blood group is AB. Then fourth person's blood group is O. O is just like a 0, means nothing. So neither A nor B antigens are present. So till now we can say that presence of specific antigen forms specific blood group. Now let's talk about specificity of antigen-antibody binding. So as you can see, we have two different antibodies, different because their antigen binding sites are different with respect to shape. And parallel to that, we have two different antigens. Different because one I suppose is circular and the other one is triangular. So if this triangular antigen tries to bind with this antibody, it will not be able to, because this triangular antigen will not fit into circular antigen binding site. Same in this case. But if I change the binding, circular antigen with this antibody and triangular antigen with this, now binding will successfully occur due to compatibility. Hence, we can say that one antibody recognizes and binds to a specific antigen only. One more important thing to remember, till now we have discussed antigens on RBCs that are naturally present in our body. But what if foreign antigen comes inside our body from outside? Then in that case, our immune system, in response to that foreign antigen, forms antibodies. Now what antibody does with antigen? So antibody is a protective protein that tries to protect our body against any foreign antigen and removes that antigen from our body. But if you remember, I had told you earlier that our body's blood contains both antibodies in plasma and antigens on RBCs. So here the question arises that why antibodies in our plasma are not attacking the antigens on our RBCs. So answer is simple, that antibodies in our plasma and antigen on our RBCs are not compatible of binding with each other. So binding is not possible. Ultimately, our body's antibody will not attack our body's antigen on RBCs. Okay, so what if the compatibility occurs between antigen and antibody in person's blood? Binding will take place successfully, and ultimately in our blood we will observe such blood clots, which is not good for a person and can lead to death. Okay, now let's see that how our body's antibodies and antigens are incompatible to each other with the help of an example. So patient number 1 with blood group A has triangular antigens, means antigen A, but the antibodies in that person are having binding sites for circular antigens, means for antigen B, so that body's own antibodies will not attack on body's own antigens on RBCs just because of incompatibility with respect to difference in shape. This antibody is known as anti-B antibody because when this antibody will come in contact with antigen B, it will attack on that antigen. Or in other words, you can say that anti-B antibody is anti or against antigen B. That's why we are calling it anti-B antibody. But this is not compatible to, or you can say it will not attack on antigen A. Okay, now let's see second patient with blood group B has circular antigens, means antigen B, but antibodies in that person are having binding sites for triangular antigens, means for antigen A. So again, they are incompatible to each other and binding will not occur. This antibody is known as anti-A antibody because when this antibody will come in contact with antigen A, it will attack on that antigen. Or in other words, you can say anti-A antibody is anti or against antigen A. That's why we are calling it anti-A antibody. But this is again incompatible to, or you can say it will not attack on antigen B. Now third person with blood group AB has RBCs with antigen A and antigen B both. Plasma in the blood of this person has no antibodies, neither anti-A antibody nor anti-B antibody, because both, if present, can attack on antigens on RBCs. Anti-A antibody will attack on antigen A and anti-B antibody will attack on antigen B. That's why none of them are present in the blood. Now fourth person with blood group O has neither antigen A nor antigen B on RBCs. Plasma in the blood of this person has both antibodies, anti-A antibody and anti-B antibody. Because as none of the antigens are present, therefore presence of both antibodies is not dangerous and they will not attack on RBCs. Now let's conclude and make one table for all that we have studied till now. If person's blood group is A, it means RBCs of that person have antigen A on their surface, but plasma of that person contains anti-B antibodies which are incompatible to antigen A of that person. If person's blood group is B, it means RBCs of that person have antigen B on their surface, but plasma of that person contains anti-A antibodies which are incompatible to antigen B of that person. If person's blood group is AB, it means RBCs of that person have both antigens, antigen A as well as antigen B on their surface. But plasma of that person contains neither anti-A antibodies nor anti-B antibodies. If person's blood group is O, it means RBCs of that person neither contains antigen A nor antigen B on their surface, so plasma of that person contains both antibodies, anti-A antibodies as well as anti-B antibodies. So students, that's all for today. In next video of mine, I'll be discussing blood transfusion and ABO blood group system specifically. For more academic knowledge, don't forget to stay tuned with your Professor Decodes.